This is the second lectures of inflammation, and the objectives of this lecture: how does the inflammatory exudate is found in acute inflammation? To know the mechanism of increased vascular permeability and the function of inflammatory exudate. How does the exudate differ from an inflammatory exudate? And what is a exudate? So these are the objectives of this lectures. So we start with the mechanism of increased vascular permeability and formation of inflammatory exudates in acute inflammation. The first mechanism of increased vascular permeability is immediate transient vascular response or vascular leakage. Meaning means immediately after injury, the vascular leak occurs. Transient for short period. مفهومة؟ This is the most common mechanism of increased vascular permeability, in which there is endothelial cell contraction, which leading to the widening of intercellular gaps. And this endothelial cell contraction is caused by vasoactive chemical mediators, such as histamine, serotonin, bradykinin, and other mediators. It occurs rapidly after injury, so it is called immediate, and lasts for 30 minutes, so it is transient. Here's the vascular leak. It is a reversible and a transient process. It means after that, the wall of the blood vessels return to normal. It mainly affects the wall of the venules because the wall of the venules is weak and very thin, easily affected by chemical mediators. This mechanism is common in a mild injury or a mild inflammation. Okay? Robert, what? This picture shows the vascular changes in the venules in acute inflammation. And this picture explains the first mechanism. This is the wall of the venule, and this is endothelial cell. There is intact endothelial cell wall, intact, and there is no gap between the endothelial cell. This is normal. The post-tabulary venules, normally, there is no gap between the endothelial cell. In acute inflammation, with the formation of chemical mediators that increase the vascular permeability, such as histamine, serotonin, bradykinin, يقطع الصوت بعد وايد يمكن النفس يعني زينة أسفل شوية. يا كلاف جاي قطع الصوت. والله بطالب الكلمة بياكله. طلابنا بياكله جاي يقطع الصوت حتى نشوف المشكلة. كلاس أي شلون الصوت؟ كلاس أي جاي يسمعوني؟ كلاس بي سمعوني؟ هذه واحدة من الطالبات اشتكت على الصوت شوية. طب يلا راح نكمل إن شاء الله. We see that histamine, serotonin, bradykinin, platelet activating factor, and leukotriene. These chemical mediators cause contraction of endothelial cells. As you see in the picture, there is formation and widening of the gap between the endothelial cells. So, these gaps permit the leak of plasma protein and formation with the plasma and formation of inflammatory exudate. Also, this is a plasma enter to the interstitial space or interstitial tissue, or called extravascular space. The same. Interstitial tissue, interstitial space, extravascular space, the same. So this will lead to the formation of inflammatory exudate in the extravascular tissue. Okay? عندكم سؤال على هذا السلايد؟ شرح واضح؟ طلاب شرح واضح؟ فهاي الميكانيزم الأولى of endothelial cell contraction. Okay. The second mechanism, which is junctional retraction, it is the same as the previous mechanism, but there is some differences between them. It is also causes widening of intercellular gaps by junctional retraction, and it is caused by tumor necrosis factor, TNF, and interleukin-1. These chemical mediators, tumor necrosis factor and interleukin-1, cause junctional retraction, while in the first mechanism, histamine, serotonin, bradykinin, and other mediators cause contraction of endothelial cells. This mechanism also affects the venules only, and mainly the vascular leak occurs through the wall of the venule. It is also a reversible process. The wall of the venules return to normal. But the onset of vascular leak not immediately after the injury or inflammation, but it is start within 4 to 6 hours. So the principle of this mechanism and the first mechanism the same, but the difference is in the chemical mediators and in the onset of the vascular leak. First mechanism begin immediately, while this mechanism there is times to occur within 4 to 6 hours. Why? Because tumor necrosis factor and interleukin-1 need times to form. يحتاج وقت حتى يتكون الدلفز من قبل الخلايا. اوكي مفهومة؟ The third mechanism is immediate sustained response or immediate sustained vascular leak. Means the vascular leak begins immediately after injury and persists for long period of time, takes days or hours. This mechanism is due to the direct injury to the endothelial cell. There is endothelial cell necrosis and detachment, which is caused by severe injury, such as burn, infections, by more serious bacteria and powerful toxins or trauma. So these may cause endothelial cell necrosis and detachment. So the vascular leaks begin immediately after the injury, means begin immediately after the burn, for example, and persist for several hours or days. And the vascular leaks occurs from the walls of venules, capillaries, and arterioles. Means the leaks occurs from all parts of microcirculation. So this mechanism is a more serious mechanism, may cause the death of the patient because of the loss of the fluid, which is the plasma, as in case of the burns. So the cause of burns in the first day or second day because of this mechanism, leading to the hypovolemic shock or circulatory collapse. So the patient with burns should be treated immediately by IV fluid or plasma to replace the loss of the plasma from the wall of blood vessels. So this is the serious mechanism of vascular leak may lead to the death of the patient because of immediate and sustained vascular leak from the wall of venules, capillaries, and arteries, which are the components of microcirculation. واضحة؟ أكو سؤال؟ أكو استفسار؟ طلاب؟ Sometimes there is a delayed prolonged vascular leak, means the vascular leak not begin immediately after injury, but delayed after hours, and it is persist for a long period of time. For some time, there is direct injury to the endothelial cells, begins after a delay of 2 to 12 hours after injury. And the vascular leak lasts for several hours or days. The leak occurs from the walls of the venules and capillaries, but not affected the arterioles. And this type of vascular leak is seen in cases of mild to moderate thermal injury, in case of radiation. I mean the radiation when we get to the treatment of a cancer or malignant tumors, and in some bacterial toxins, may cause this type of mechanism of increased vascular permeability, which is called delayed prolonged vascular leak. واضحة كلها؟ The fourth mechanism of increased vascular permeability is leukocyte-mediated endothelial cell injuries. Means leukocyte causes endothelial cell injury. This is late vascular leak or vascular response. Why? Because leukocyte need time for accumulation, activation, and releasing of proteolytic enzymes. Then cause endothelial cell injury or detachment. And also it is most affected the venules. As we said, the wall of the venules are delicate and weak, not as the wall of the arterioles or cavities. So it is easily affected by the chemical mediators. Okay, so this fourth mechanism is due to the leukocyte accumulation and activation and releasing of proteolytic enzymes, which are chemical mediators causing endothelial cell injury and detachment. And it is late vascular leak. Why? Because leukocytes need time to accumulate and activate, and then release proteolytic enzyme, causing increase in the vascular vulnerability by endothelial cell injury. The fifth mechanism is increased transcytosis of protein by formation of channels within the cytoplasm of the endothelial cell that transport the protein and plasma into the extravascular spaces. This mechanism also occurs in the venules. The sixth mechanism is vascular leakage from the new blood vessels, which is called angiogenesis. Angio, angio means blood vessel. Genesis means formation. During the repair of injured tissue, the healing is occurred by formation of new blood vessels. These new blood vessels are immature blood vessels. Their walls are weak, so permit the leak of fluid from their wall until it has become mature, and the vascular leak stops. When the wall of the blood vessel, this new blood vessels, become mature, the leak from it is stopped. Okay? The vascular leak from new blood vessels, which is called angiogenesis, in repair tissue, or when the healing and the repair start in the inflamed tissue. So these new mature blood vessels are weak and delicate walls. They permit the fluid to leak from them until it becomes mature, then stop leaking. Okay? So these are 6 mechanisms of increased vascular permeability. And these 6 mechanisms are responsible for making opening or gaps in the wall of the blood. But the movement or exchange of the fluid across the wall of the blood vessels are controlled by 2 processes. And the movement of the fluid across the wall of the blood vessels is active process, need energy and need forces to move. Okay? So there are 2 opposing forces in the body which control the movement or exchange of the fluid across the wall of the blood vessels in our body. So there are hydrostatic pressure, which is responsible for pushing the fluid out of the circulation, and the plasma osmotic pressure, which is responsible to pull the fluid into the circulation. The hydrostatic pressure push يدفع السائل، والosmotic pressure يسحب السائل إلى السيركوليشن. The plasma osmotic pressure depend on the plasma protein. يعني قوة البلازما osmotic pressure يعتمد على البلازما protein. So these are 2 forces. There are balance between the hydrostatic pressure and plasma osmotic pressure normally. there is balance between these two opposing forces. So the net result, there is no fluid will be accumulated in the extravascular spaces. In acute inflammation, there is imbalance between hydrostatic pressure and plasma osmotic pressure. Hydrostatic pressure within the circulation is increased in acute inflammation. Why? Because of vasodilation and increased blood flow lead to the increase in hydrostatic pressure in acute inflammation. While plasma osmotic pressure is decreased. Why decreased? Because there is loss of plasma protein from the circulation to the extravascular tissue. So the hydrostatic pressure push the fluid outside the circulation. And plasma osmotic pressure cannot return or pull the fluid into the circulation because it is weak due to the loss of plasma protein to the outside of the circulation. In addition, osmotic pressure of interstitial tissue in the extravascular space, osmotic pressure is increased. Why? Because it gets protein from intravascular space. Also, it is a pull of fluid towards there. مفهومة هاي طلاب؟ لو أعيد لكم إياها. طلاب مفهومة؟ لو أعيد لك. هسه بالعربي أشرح لكم إياها. الميكانيزم الستة اللي ذكرناها هاي شنو راح تسوي؟ راح تفتح نوافذ أو فجوات بالوول أوف بلاد فيسلز حتى يتحرك السائل. بس حركة السائل تحتاج لها قوة تدفعها وتسحبها. فاحنا بالجسم عندنا قوتين متضادة هي الهيدروستاتيك بريشر والبلازما اوزموتيك بريشر. الهيدروستاتيك بريشر بوش ذا يدفع، والاوزموتيك بريشر يسحب، والاوزموتيك بريشر يعتمد على البروتين الموجود بالبلازما. القوة مالته جاية من البروتين. فبالاكيوت انفلاميشن راح يصير اختلال ما بين هاي القوتين. احنا نورمالي there is balance. فبالحالة النورمال باجسامنا اكو توازن ما بين هاي القوتين. فالمحصلة النهائية ان الفلويد او السائل ما يتجمع باجسامنا. بالاكيوت انفلاميشن راح تختل هاي القوتين. الهيدروستاتيك بريشر راح يزداد. ليش يزداد الهيدروستاتيك بريشر؟ لأن صار فازودايليشن، توسع بالأوعية وزاد جريان الدم. فالهيدروستاتيك بريشر يعتمد عليه. فراح يدفع الفلويد outside the circulation into intravascular space. نفس الوقت الأوزموتيك بريشر قل كلش قل لأن فقد بروتين من داخل الأوعية الدموية. فقد البروتين فقوته ضعيفة ما يقدر يسحب الفلويد. وفي نفس الوقت الأوزموتيك بريشر مع الانترستيشال تيشو خارج الأوعية الدموية بالنسيج، هذا الأوزموتيك بريشر ازداد. ليش ازداد؟ لأن إجاله بروتين. ازداد الأوزموتيك بريشر مع الانترستيشال تيشو. فالهيدروستاتيك بريشر يدفع الفلويد وفي نفس الوقت الأوزموتيك بريشر of the interstitial tissue سحبه. بس الأوزموتيك بريشر داخل الأوعية الدموية ما يقدر يسحب يرجع إلى داخل الأوعية الدموية. فهاي هي المحصلة النهائية. شنو راح يصير؟ إنه يتجمع الانفلاماتوري exudate or edema in the interstitial tissue lead to the formation of inflammatory exudate in acute inflammation. فهذه هي mechanisms of formation of inflammatory exudate. تعتمد على من؟ تعتمد على الميكانيزم الستة اللي بتفتح النوافذ والفجوات بجدران الأوعية الدموية، واللي بتعتمد أيضا هذه النوافذ هذه الفجوات في الأوعية الدموية ما يقدر السائل يتحرك بها إلا إذا وجود قوة حركة اللي هي الهيدروستاتيك بريشر والأوزماتيك بريشر. وجود هاي القوتين هي اللي تتحكم بحركة السوائل. صحيح أكو فجوات انفتحت ونوافذ انفتحت بالجدران، بس الفلويد ما ممكن أن يتحرك لوحده، وإنما يحتاج إلى قوة دفع والسحب. فاختلال التوازن ما بين هاي القوتين المتضادة الهيدروستاتيك بريشر والأوزماتيك بريشر بالأكيوت انفلاميشن أدت إلى تكوين الانفلاماتوري اكزوديت. مفهومة؟ أكو سؤال؟ We come to the function of inflammatory exudate. As we said, the inflammation is a protective defense mechanism. In the first lecture, we said the inflammation is a protective defense mechanism. Why? Because of the beneficial effects of inflammatory exudate. Inflammatory exudate has beneficial effects and harmful effects. So we start with the beneficial effects of an inflammatory exudate that make the inflammation as a defense mechanism. So first, we have inflammatory exudate cause dilution of toxins and chemical agents, and then removed of these toxins and chemical agents by lymphatic drainage to the lymph nodes. Protective antibodies are present in the exudate, which is held in the phagocytosis and neutralization of bacterial toxins by antitoxin. Also, an inflammatory exudate contains fibrin meshwork, which delays the bacterial spread and help in the phagocytosis. Fibrin present in the inflammatory exudate help in the phagocytosis and also formation of meshwork that delays the bacterial spread. An inflammatory exudate contains plasma mediator proteins, which play an important role in the inflammation. Also, an inflammatory exudate brings cellular nutrition such as glucose and oxygen to the cells of the tissue. At the same time, removed of the waste products from the cells of the tissue. And the last important function of exudate is a promotion of immunity by stimulation of immune system to produce antibodies, because an inflammatory exudate is drained to the regional lymph node by lymphatic vessel and stimulate the immune system to produce antibody against the bacterial or anti-other microbial antigens. So these are the 6 beneficial effects of inflammatory exudate. But inflammatory exudate has also harmful effects, such as accumulation of inflammatory exudate in the tissue causing swelling. And the swelling lead to the mechanical obstruction of the lumen of the organs with asphyxia, اختناق, as in acute laryngitis. This picture shows this is acute inflammation of the larynx. You see there is redness and swelling of larynx with narrowing of the airway. This is narrowing in the airway of the larynx, for causing asphyxia. الاختناق. Also, swelling interfere with the blood supply because of swelling of tissue causes pressure on the blood supply and obstruct the blood supply, leading to the ischemia of the tissue. as in cases of acute meningitis and encephalitis, causing pressure on the blood vessels in the brain, leading to the ischemia of the brain tissue with increase in the intracranial pressure, causing coma and death of the patient. Also, interfere with the blood supply, causing ischemic necrosis in the bone, as in cases of acute osteomyelitis, التهاب نخاع العظم الحاد. It causes necrosis of the bone. Other harmful effect of inflammation is, or inflammatory exudate, it is inappropriate hypersensitivity reactions. All types of hypersensitivity reactions are regarded as a harmful effect of inflammation. So these are the beneficial and harmful effects of inflammation. Any question? Or beneficial and harmful effects of inflammatory exudate. Any question؟ أكو أي سؤال؟ صوت واضح؟ We come to the transudate. What is a transudate? Transudate is plasma ultrafiltrate. What are the causes of a transudate? Transudate occurs either there is an increase in the hydrostatic pressure, as in the congestive heart failure, or decreased plasma osmotic pressure, either due to the loss of protein, as in case of renal failure, or there is no production of protein in the body, as in the liver diseases and liver cirrhosis. You know, the liver is the factory for the formation of proteins in the body. So when there is no production of proteins in the body by liver disease or liver cirrhosis, causing decrease in plasma osmotic pressure, and this will lead to the accumulation of the fluid in the body. Also, when there is loss of protein from the body, as in cases of the renal failure, due to the loss of protein in the urine, osmotic pressure is decreased, and due to the accumulation of the fluid in the body. Or transudate is due to the removal of interstitial fluid by lymphatics. When there is obstruction in the lymphatic vessels or lymphatic channels, there is no fluid will be removed from the tissue, and it will be accumulated in the tissue because of obstruction in the lymphatic vessel or lymphatic channels. So these are the causes of the formation of transudate. Any one of this can cause a transudate. So the transudate is defined as excess ultravascular is an excess extravascular fluid, means plasma ultrafiltrate with low protein content and specific gravity of 1.012 or less. Okay. So there is a difference between transudate and exudate. Exudate has high protein content, transudate low protein content. The specific gravity of exudate is 1.020 or more, while the transudate specific gravity 1.012 or less. And the transudate does not form in the acute inflammation, or form very early, very early in acute inflammation, or not form in acute inflammation, while exudate is formed in acute inflammation. أكو any question؟ أي سؤال؟ regarding exudate and transudate. This is a transudate. You see, this foot with the pitting edema, swelling of the foot as in cases of congestive heart failure. There is edema in the lower extremities, which is pitting edema, you see. And this child has generalized edema, puffness in the face, distended abdomen due to the accumulation of the fluid in the peritoneal cavity, and also he has pleural effusion. This child has nephrotic syndrome with loss of protein in the urine, causing generalized edema. This table shows the difference between transudate and exudate. As we see, the transudate is plasma ultrafiltrate, while exudate is inflammatory fluid. The onset. Transudate may be formed early, very early in the acute inflammation, or not formed at all, while exudate is formed late in the acute inflammation. The appearance, transudate is clear, serum-like, while the exudate is turbid due to the cellular debris and high numerous number of neutrophils. Consistency, transudate is liquid, serum-like, while the exudate is viscous, like pus. Specific gravity, as we say, transudate 1.012 or less, the exudate 1.020 or more. The protein content, transudate less than 3 grams per deciliter, low protein content, while the exudate more than 3 grams per deciliter, high protein content in exudate. Cell content, transudate scant, or there is no cell, while there is numerous neutrophils in the inflammatory exudate. The causes, transudate either caused by heart or renal failure or liver diseases such as liver cirrhosis, and the exudate only formed in acute inflammation. Okay, these are the difference between transudate and exudate. Any question? Thank you very much for your listening. Any question؟ محاضرة واضحة؟ أكو سلايد ما فاهمينه نرجع عليه مرة ثانية.